22-year-old girl comes to the hospital complaining of fatigue, dizziness, and shortness of breath. She says she is always tired, can't concentrate, and recently noticed her nails becoming brittle. What could be the reason? The reason is one of the most common diseases you will see in medicine, that's anemia. But here's the interesting part: anemia isn't a disease by itself, it's a sign that something is wrong inside the body. Is it iron deficiency, vitamin B12 deficiency, or blood loss, or something happening in the bone marrow? In the next 10 minutes, I will help you understand anemia from the basics to clinical approach using simple diagrams, flowchart, and high yield exam points. By the end of this video, you will be able to classify anemia and understand its causes and recognize its symptoms and solve MBBS and NEET PG questions with confidence. So let's begin with one simple question: what exactly is anemia? Anemia is the blood disorder characterized by the reduction in red blood cell count, hemoglobin content, and packed cell volume, leading to reduction in supply of the oxygen to the tissues. Then causes of anemia: reduction in the RBC count and hemoglobin content and packed cell volume. Here are the three main reasons for reduction of RBC count: that decreased production of RBC, increased destruction of RBC, and excess loss of blood from the body. These are caused by the inherited disorders, some infections, some nutritional conditions, and some environmental conditions and drugs. Hence, here are the two classified: morphological and etiological. Morphologically, it depends on the size and color of the RBCs. Normocytic or normochromic. Normochromic means large cell and normal color. Here large cell but faint color, and here small size and faint color. It is the microcytic hypochromic. And etiologically, it divided into 5 types, that is hemorrhagic anemia, hemolytic anemia, nutritional deficiency anemia, aplastic anemia, and anemia of the chronic diseases. Then we will discuss in little detail etiological classification. First is hemorrhagic anemia, that is acute or chronic, and acute may be normocytic, normochromic, and but chronic is may be microcytic and hypochromic. Anemia due to excess loss of the blood. It is the reason behind the hemorrhagic anemia. The second one is hemolytic anemia. Anemia due to excess hemolysis means the destruction of the RBC. Here is excess loss of blood, and here destruction of RBCs, which is not compensated by increased RBC production. At that level of destruction, that is not compensated by the RBC production. There are the two types for hemolytic anemia: extrinsic and intrinsic. Extrinsic is due to hemolysis due to external factors, that are the antibodies, drugs, chemicals, infections like hepatitis, malaria, and burns. And in intrinsic factors are there due to defective RBCs, unhealthy RBC production, short-lived RBCs in the diseases like sickle cell anemia and thalassemia. Sickle cell anemia, it is the inherited blood disorder characterized by sickle-shaped red blood cell which contain abnormal hemoglobin, and its features are alpha chains are normal but beta chains are abnormal. RBC contains sickle shape means the crescent shape. In the children, hemolyzed sickle cells aggregate and block the blood vessels, leading to infarction, stoppage of the blood supply, and infarction in small bones in hand and foot. Then hand and foot syndrome occur, and jaundice also occur in this condition in the children. Next, the thalassemia. It is the presence of the abnormal hemoglobin in the RBCs. It is also called as Cooley's anemia. Here are the two types of the thalassemia. It is the alpha thalassemia and beta thalassemia. Occurs in fetal life and infancy, and alpha chains are less or may be absent also. In your adult, beta chains in excess, and in children's, delta cells chains in the excess. Defective erythropoiesis and hemolysis. Here beta chains are less in number or may be absent, and excess alpha chains are present. Defective erythropoiesis and hemolysis is there. Third type, it is the nutrition deficiency anemia. Anemia that occurs due to deficiency of the nutritive substances necessary for erythropoiesis is called the nutrition deficiency anemia. First one is the iron deficiency anemia, microcytic and hypochromic, develops due to inadequate availability of the iron for hemoglobin synthesis. The features of the iron deficiency, that is brittle nails, spoon-shaped nails, brittle hairs, atrophy of the papilla in tongue, and dysphagia, that is the difficulty of the swallowing. Here is the important clinical questions may become for our university exams also. Here are the features you should write there, and the causes: loss of blood, decreased intake of iron, poor absorption of iron from intestine, increased demand for iron in conditions like growth and pregnancy. And second one is protein deficiency anemia. It is the microcytic and hypochromic anemia. And in this nutrition deficiency anemia, it is the third type, the pernicious anemia, or also called as Addison's anemia. It is due to deficiency of malnutrition factor of the RBC, that is vitamin B12. Vitamin B12 deficiency is due to atrophy of gastric mucosa because of autoimmune destruction of parietal cells. In the stomach, parietal cells form the gastric juice, and that cells form chief cells, and parietal cells are present in the stomach, and that gastric mucosa forms this B12. It is more important in the absorption of the food, but because of this absent, gastric atrophy is formed, occur, and decrease the production of intrinsic factors and poor absorption of B12. Microcytic or normochromic or hypochromic is anemia, and the features for the pernicious anemia more common in females than males: lemon yellow color of skin, red sore tongue, neurological disorders, that is paresthesia, and abnormal sensations like numbness, tingling, and burning, progressive weakness and ataxia. Megaloblastic anemia, that is a fourth type, deficiency of another maturation factor called folic acid. Here RBC is not matured. DNA synthesis is abnormal, hence megaloblastic and hypochromic. Neurological disorders may not develop. Here, fourth type is aplastic anemia due to disorder of red bone marrow. Conditions: it is because of the repeated exposure of X-rays, presence of bacterial toxins, quinine, gold salts, and benzene. And third reason is tuberculosis. This anemia is normocytic and normochromic. Fifth one is the anemia of the chronic diseases develops after few months of the sustained disease. That the common causes are: first, non-infectious inflammatory diseases, that is rheumatoid arthritis. It is the autoimmune disorder associated with the anemia. Second one is the chronic infection, that is tuberculosis. Third one is the chronic renal failures, and then fourth one neoplastic disorders like Hodgkin's disease, that is the malignancy involving lymphocytes, cancer of lung and the breast. Then the signs and symptoms of the anemia are the increase in basal metabolic rate. Skin becomes pale or yellow, thin, dry, and non-elastic, early grayness of the hairs. Tachycardia, increase the cardiac output, and angina. Hyperventilation and dyspnea. Headache, lack of concentration, restlessness, irritability, and fainting. Disturbance in menstrual cycles, weakness in muscles, easily fatigue. Liver enlargement, dysfunctions in sickle cell anemia, jaundice, and hemolytic anemia. Here anemia is fully covered. These are the signs and symptoms, these are the types, and each type in detail. If you like it, share, like, and subscribe, and stay tuned for the next disease. Thank you.